Welcome to this video for pre-hospital emergency care mask wearing. In this current climate with the COVID-19 very present, it's important that we follow health and safety advice from our own organisations and read the up-to-date information, because there is some information which is changing daily. The information I'm going to provide today is just basic information, generic information, which I've gathered from the government website, from the Resuscitation Council website, and from the manufacturers of the mask themselves. If we go to a suspected or confirmed case of COVID-19 patient, a surgical mask is good enough to provide a filtration. There are a number of filtration masks available, as you can see. These type here are the surgical masks, some of which come with visors, some of them which come with ear loops, and some of them which are tied off. This particular surgical mask here is a type 2R mask. This one is good for healthcare professionals going to a suspected or confirmed case of COVID-19. The blue side is the outside of the mask, the white side is the inside. There's aluminium at the top to bend around your nose, and there's ear loops to put on to yourself. The mask itself is made up of 3 layers. The outer and inner layer are both fluid repellent, so that you can't have any fluid going into you, and your fluid that you're producing won't go out. And in the middle is a filtration material as well. Before we pick up our mask or do anything, we're going to make sure we use good hand hygiene. Now, obviously, it would be much better to use soap and water to wash our hands thoroughly before putting on our PPE. But in the pre-hospital environment, we haven't always got that luxury. So sometimes we need to use an alcohol-based gel of at least 60% alcohol. Once we've cleaned our hands and allowed that to dry, we're then going to apply our mask. So taking the ear loops, carefully placing it over our ears, trying not to touch our skin, pulling the mask down so it goes underneath our chin, and then shaping the aluminium around our nose, making sure we've got a snug fit. After we've dealt with our patient, we would then clean our hands again, and then carefully taking the ear hoops, lifting it off and dropping that into our clinical waste. We would then perform hand hygiene again. Let's have a quick look at the inside of the mask. As you can see from this mask here, as I open it up, there are 3 layers. So the blue is the outer layer, which was the fluid repellent. The middle is the filtration, claiming to be 99.7% effective of stopping bacteria passing through. And then the inner layer, the white side there, which is also water repellent to stop any fluid from coming out. You may also be given other personal protective equipment to wear at the same time as the mask, such as goggles or face shields, which we'll look at in combination with our other masks. A grade up from the surgical mask, and particularly the type 2R, is the FFP3 mask. Now, there is a lot of confusion out there about what FFP3 is. FFP3 is the face filtration piece level 3, so it gives us a high level of protection. All of these masks here are all FFP3 level, and you may have been tested in the past on a number of different masks. There's lots of different models out there. If you have been tested and you pass that fit test, that mask is still good for you. And if you've got some of them masks in stock, don't throw them away, make sure you use them. But if you do have a new model which is available to you, you will need to be fit tested to make sure it creates a good seal on your face, because not everybody is the same. So we're just going to have a look at this particular mask here. This one's from 3M. This is the 8833 mask. Make sure you always read the manufacturer's instructions of how to put the mask on. The mask will always work best if we are clean shaven in the area where the mask is going to be touching our face. Once again, hand washing is extremely important. The ideal would be soap and warm water, but in the pre-hospital environment, you might have to use your alcohol gel. When you've got your mask, holding the mask upside down. This time the two elastics are hanging down, the nose piece, the aluminium at the top. I then place the mask directly under my chin, up onto my nose, so I get a good seal straight away. I can then place the elastics around the back of my head, one coming to the crown of my head, the other elastic coming all the way to the base of my neck. So we're coming either side of our ears. Make sure the mask feels comfortable, and then adjust the nose piece, so pushing both sides to get a good seal around the mask. Now I feel this is the most important bit now. You have to do your own pre-check to make sure you can't feel any air coming out around the mask at all. Because in theory, if air can come out, contaminant can get in. So we can start with just holding the mask, a sharp breath in, sharp breath out, and we can make sure no air comes around the seal. You may feel air coming out through the valve, but you can easily block the valve and do the test again. And the other thing is, as you do the breath in, you can feel the mask sucking towards you. I'm happy I've got a good seal around my mask. If I am provided with eye protection from my organisation, I will also be wearing this. They come in a different range, from basic goggles to a more enhanced model, which gets a better seal all the way around our face. You may even be provided with a splash shield as well, or as an alternative. You must make sure you follow all local policies and procedures for wearing your mask and protective equipment. To remove your mask, you will always do good hand hygiene. Again, preferably washing with soap and water, and you can also use your alcohol gel. Trying to minimise any contamination, so taking the elastic from the back of your head, dropping the mask off, and that can be dropped straight into clinical waste, as it would be single patient use. So just to confirm, we would require to wear the FFP3 mask when we're doing any aerosol procedures, such as chest compressions during a cardiac arrest, the use of an oral pharyngeal airway, supraglottic airway, or intubation. There is no need to wear the FFP3 if there is no aerosol procedures taking place. I hope this video has been helpful for you. Please remember to subscribe to our channel, click the like button, and if there's any other videos that we could make for you, please leave a comment below. Thank you.